A very good evening to everyone. My name is Dr. Amit. Mommy Makeover is the topic for today, and it's an amazing topic that we have because it is getting extremely popular worldwide. Many patients are confused as to what is a mummy makeover, what all are the components of mummy makeover, how do we recover, how long does it take, what all should we do, how to decide what is to be done. So in the next 5 to 10 minutes, I'm going to discuss great details about the mummy makeover procedure, which will really help you take a decision. So first, what are the components of a mummy makeover? It all depends on the patient. The usual components are abdominal liposuction along with tummy tuck in some form or the other. I'm going to discuss that later. Second, management of the breast. It could be breast reduction, it could be breast enhancement, it could be breast lift, it could be breast lift with enhancement. Third, intimate areas. We could do a vagina tightening, we could do labiaplasty, we could do fat injections of the vagina, we could do a lot of things, and I'm going to discuss during the course of this video how you can select your procedure based on your clinical condition. In general, a mummy makeover is done to correct all the problems created by the delivery or the birth of a child. So a lady becomes a mother, but during that process, the child causes a lot of changes in your body. If you're seeing this video, obviously you're interested because you've seen the changes in your body. Breast sagging down, breast becoming big, not that voluptuous high look that you had, tummy skin sagging, vagina getting loose, sexual intimacy not creating that great an effect as it used to be once upon a time. If these are problems that you face, you are sitting at the perfect place because this video is then only and only for you. At the end of this video, you will be able to clearly define what all are the problems that are present for you and how you can literally select your procedure sitting at home. It is not mandatory that you do all the components of a mummy makeover program, but you can actually select and discuss with your doctor as to what all you'd like to do. So let's begin one by one. The first topic is the female breast post-delivery, post-birth or post-pregnancy. When we examine the breast, the problems that we see post-pregnancy in a mother are the breasts are either small, they have lost the volume, they have become deflated, they are flat on the top and sort of sagging, curving downwards, or they have really fallen down with loss of volume. Sometimes they become big, much bigger, and the end result is you as a patient are not happy with what you have. What can we do? What can we do to make your breast better? If you have a breast which is where it is supposed to be not gone down, all you need is a breast implant. Simple, 25-minute procedure, do it, same evening discharged, back home, next day office, easy peasy, as simple as that. If you have a breast which is sagging down and the volume is also less, you have lost the volume of the breast, then you need a lift along with a breast implant. A breast implant alone is not sufficient. Why? Let me explain that. Suppose your breast is fallen down here and I put an implant on top. You actually have two breasts, one here and one here. Unless you lift up the breast and fit it here, it doesn't work. So what you need is a dual plane technique with internal bra to fix the breast at a particular position along with cleavage, fat injection for cleavage creation. A third scenario could be that you have sagging but good volume of the breast. Then all you need in that case is a breast lift surgery. As simple as that. Implants are not really mandatory in such a situation. Fourth, if you have heavy breast, then a breast reduction and breast lift is the technique of choice for you. It creates great results. You can reduce the breast as much as you like, right? So that defines what all are the procedures of the breast in a mummy makeover. And sitting at home, now you can look at yourself in the mirror and decide which of these do you need. Let's move on to the second topic, the abdomen. If you've got a tight abdomen, skin is not loose, you want a quicker recovery, just do a 360-degree liposuction. Liposuction all around, creation of the hourglass, maybe some fat into the buttocks, a BBL kind of a procedure. If you've got very little amount of loose skin, just at the lowest part of the abdomen, you need a 360-degree lipo with shaping, and then you need a mini tummy tuck. The position of the belly button is not changed in this. It just comes down a little bit. We don't need to cut the belly button. Suppose there is more skin looseness, there is muscle weakness, and you look in the mirror and you find your whole lower abdomen skin just like a bag of worms, then you need a full tummy tuck. So do a 360-degree lipo, do a tummy tuck, and get a nice flat abdomen. You can even get 6 packs along with that tummy tuck procedure. Now, it is also possible that you have skin looseness in the lower abdomen, on the sides, and even on the back. In that case, you need a belt lipectomy, in which we remove skin from the front, side, and back. So that is the complete procedure in this situation. So now it makes it very simple for you to look at yourself in the mirror and decide what you want. Recoveries: liposuction takes about a week, a mini tummy tuck a week, a full tummy tuck can take about 10 days, and a belt can take about 2 weeks. As simple as that. You can actually be back in office after an abdominoplasty in 12 to 13 days. After a belt, you can be back in office as soon as 20 days or so. Let's move on to the intimate areas. If you have vaginal looseness, all we need to do is vagina tightening. Vagina tightening is a great procedure. We tighten all the muscles, we reduce the opening of the vagina. A laser vagina will not work for you. Please note this, it will not work for you. You have to do a surgical vaginoplasty, a surgical vagina tightening. It takes about 45 minutes, but many times we actually combine it with labia minora repair as well. So some women have extra labia minora. This comes out, creates wetness in the undergarments. If you're an athlete, it's a big problem. Sometimes if you wear a thin panty, the lips actually come out. Looks very, very embarrassing. So we do a labiaplasty. We even do a Barbie doll labiaplasty for someone who does not want any form of labia at all. Third, we can even do some fat injections around the vagina to give it a very sexy look. If you have been suffering from poor orgasms, you can even do an O shot and improve the orgasms in your sexual activity. So these, my dear friends, is a combination of these procedures is known as the Mommy Makeover. On an average, we feel if you're coming in from outside India, you should stay with us for about a week. If you're coming from India, if you're within the country, then maybe 4 or 5 days is enough and you can actually go back, rest for some more time, and then get back to office. Many of our international patients across the globe, Australia, in UK, have been actually gone back to office as soon as 2 weeks after a belt lipectomy procedure. So if you plan a procedure, then please make sure to analyze yourself. The way I have explained in this video, analyze your whole body so that you can decide what you want, and you can actually work with the plastic surgeon of your choice to plan the whole procedure so that you get the best satisfaction.